Hello and welcome, all you amazing nurses and students. Whether you're gearing up for a big exam or just want to keep your skills razor sharp, you are in the perfect place. We're about to challenge your core knowledge with a fun, interactive quiz. So let's see what you've got. Let's jump right in. So here's the game plan. Our challenge is broken down into 3 rounds. We'll start with the basics, bodily functions, then we'll get into the tricky business of diagnosis, and wrap up with life-saving treatments. And at the very end, we'll see how you did and go over the key takeaways. The format is super simple. I'll throw a question up on the screen with a few options. I really want you to pause the screen, think it through, and lock in your answer. After that, we'll reveal the correct one, and I'll give you the full breakdown so that knowledge really sticks. Sound good? Okay, let's get started. All right, round 1 is all about the fundamentals. You know, the incredible processes and anatomy that are the absolute foundation of everything we do in nursing.
First one up is a big one for the endocrine system. Which organ is our insulin powerhouse? Is it A, the liver, B, the pancreas, C, the spleen, or D, the kidneys? Go ahead and pause if you need a second.
If you said B, the pancreas, you are absolutely right. See, tucked away inside the pancreas are these tiny cell clusters called the islets of Langerhans, and that's where the magic happens. It's a perfect example of how specialized our organs are. The liver is busy detoxing, the kidneys are filtering, but the pancreas, it's our dedicated insulin factory, keeping our blood sugar in check. Okay, great start. Next question, we're shifting gears to hematology. What is the main job of those little cell fragments we call platelets? Is it A, carrying oxygen, B, fighting infection, C, blood clotting, or D, transporting nutrients? And the answer is C, blood clotting. This really shows you how our blood is like this incredible team of specialists. You've got your red blood cells, they're the oxygen delivery service. You've got your white blood cells, they're the immune system's army. And the platelets, they're the emergency construction crew, rushing to the scene of an injury to plug the leak and start that crucial clotting process. Let's head over to neurology now. Think about something as simple as walking across a room. What part of your brain is making sure you stay upright and don't fall over? Is it A, the cerebrum, B, the cerebellum, C, the medulla oblongata, or D, the hypothalamus? If you picked B, the cerebellum, you nailed it. Here's a good way to remember it. The cerebrum handles all your big conscious thoughts, right? But the cerebellum is like the silent coordinator in the background, making sure all your movements are smooth and precise. And the medulla oblongata? That's your autopilot, handling all the stuff you don't think about, like breathing and your heartbeat. Fantastic job in round 1. So now that we've got the body's normal operations down, let's jump into round 2 and figure out what happens when things go a little sideways. Welcome to Diagnosing Dilemmas, where we connect the dots between symptoms and conditions. Okay, our first diagnostic puzzle is a test of your terminology. If you see a lab report with an abnormally high white blood cell count, what's the term for that? Is it A, anemia, B, leukocytosis, C, thrombocytopenia, or D, leukemia? This one trips people up, so think carefully. The correct medical term here is B, leukocytosis. And listen, this is a super important distinction. Leukocytosis usually means the body is actively fighting something, like an infection. Leukemia also involves white blood cells, of course, but that's a cancer. Meanwhile, anemia is about low red blood cells, and thrombocytopenia means low platelets. Being precise with our language is absolutely key.
All right, here's a classic clinical picture for you. Imagine a patient comes in with night sweats, unexplained weight loss, and a cough they just can't shake. What diagnosis should be jumping to the top of your list? A, tuberculosis, B, pneumonia, C, asthma, or D, bronchitis?
And the answer is A, tuberculosis. This combination of symptoms is what we call a classic triad. It's the calling card for TB. Sure, the other conditions are respiratory, but they don't usually come with that specific systemic pattern of night sweats and weight loss. Recognizing these patterns is a huge part of being a great diagnostician. Okay, let's talk lab values. A patient's blood work comes back, and you see that their uric acid levels are high. Which condition does that immediately make you think of? Is it A, rheumatoid arthritis, B, gout, C, osteoporosis, or D, fibromyalgia? And that would be D, gout. This is the perfect example of how a specific lab marker can point directly to a disease. That extra uric acid, hyperuricemia, literally forms these painful, sharp little crystals in the joints. So even though it's a type of arthritis, its cause is totally different from an autoimmune condition like rheumatoid arthritis.
You are doing awesome. We've covered physiology and diagnosis. Now it's time for our final round, treatments and care. This is where the rubber meets the road. We're talking about the procedures and interventions that directly save and improve lives.
Here is a super practical question you will use all the time. When you're giving an intramuscular injection to an adult, which site is considered the safest and is the preferred standard of care? Is it A, the deltoid, B, the dorsogluteal, C, the ventrogluteal, or D, the vastus lateralis?
The correct answer is C, the ventrogluteal site. And this really shows how nursing practice evolves as we learn more about anatomy. For years, the dorsogluteal site was really common, but we now know it comes with a serious risk of hitting the sciatic nerve. The ventrogluteal site, right there on the hip, is the modern gold standard because it's clear of any major nerves or blood vessels. Safety first.
Okay, this is a critical life or death question. In the middle of an opioid overdose, what is the #1 antidote you need to administer? Is it A, atropine, B, flumazenol, C, activated charcoal, or D, naloxone?
The answer, without a single doubt, is D, naloxone. It's an opioid antagonist, which means it literally kicks the opioids off the receptors in the brain, and it can reverse that deadly respiratory depression in just minutes. This is a crucial reminder that you have to know the right antidote for the right substance. Giving flumazenol for benzos or atropine for bradycardia would do nothing and would be a complete disaster.
And that brings us to the end of our final round. Seriously, fantastic work. It doesn't matter if you got every single one right. The real goal here is to make these core concepts stick. So let's do a quick flyby of the biggest takeaways. First, physiology is the foundation of everything. Understanding why the pancreas makes insulin makes you a much better nurse. Second, getting your terminology right is absolutely essential for an accurate diagnosis. Third, learning to spot those classic symptom patterns will help you act faster. Fourth, safety is never ever negotiable. And finally, in an emergency, knowing the right antidote at the right time is the difference between life and death. So as we wrap things up, I want to leave you with one final question, just for you to think about. Which of these topics really made you pause and scratch your head? Whatever it was, use that as your guide for what to brush up on next, because being a great healthcare professional is all about continuous learning. Thanks so much for joining me today, and remember,